own screenshot and everything. No, I think that's been good to go ahead and do it.
Yeah, over. Lane 6.
5 folks to distribute back here. You want to?
We'll have you two right over here and here.
There we go. That'll work.
Like this?
Yep.
Or over there?
Yeah, just
Socially distant. And then you stay.
Yep.
That way the mayor can step
I'll
back
just
right
get back. And then Dr. Hartlage, you want to take that? Okay.
Thanks, Doc. Keeping us straight.
I'm bossy.
There's nothing wrong with that. Nothing wrong with that at all.
Regan's doing a pretty good story.
I'm scared. Well, when they told me that yesterday, it was like, oh, come on, really?
What's funny about it though is that for everybody else in here, it's like so loud. But it's like I'm thankful that she's up there because it's at least pushing people.
That's her line.
They have to go and
That
that's
is
what
so
makes
great.
it fun. Like we have him there because we make him there.
Oh my God.
And going where they need to go.
Oh, that's so cool.
The bossy she gets from her mom.
That's my job. And I don't do it very often, but I'm
Sometimes.
I just feel like the unit's getting a little weird.
They won't let us play music, you know?
Rick was saying we should do a video on the back.
Oh, yeah.
Thanks for your leadership.
Hey, Mayor. We've got a handheld here if you want to use that when you interview these folks. There's a slight delay when you turn it on.
okay. A young lady on the park today. She's worked with us for about 3 days.
All right.
And she was
Hello, guys.
she was starting to get the hand job
All right.
going. I was like,
Ready to roll? Kathy.
Good
Good morning to you.
I mean,
Thank you.
it's all about having fun.
it is.
All right. Good morning, everybody. We ready to roll? Looks good. All right. Well, think about this week is important in so many different ways, but 1 year ago in particular, our lives really changed. This is when we really started understanding that COVID was going to be part of our lives. Of course, we had heard about it being in China and Seattle area, but it started hitting our community about 1 year or so ago. And boy, think about the toll that it's taken here in our community. Unfortunately, in the next several weeks, we'll be reaching the 1,000 mark of people that we've lost due to COVID-19 in Louisville. And when you think about that 1,000 and all the families and friends behind them, it's just devastating. When you think about our country, over 530,000 people we've lost now to the vaccine. And it's something that we haven't seen in any of our lifetimes. And then along with these costs to our country, think about our kids and what's happened to them with their education and the stress and uncertainty of this past year and how that's affected their households as well. So I think it's important that we do look back so that we can see where we were and where we are now and where we're going, because now there is more hope than ever. I mean, I think everybody feels that. And when I talk with our friends here or friends in the media, everybody says, we're feeling a little bit different right now. And that's fantastic. When you think about this place here that you all have been coming to for the last 8, 9, 10 weeks or so, this to me is the center of our hope and possibility here in our city. The vaccines that are being distributed here and vaccines that are being distributed elsewhere are making it possible to have life after the pandemic, which we're all looking forward to. And last night, I'm sure many of you all watched President Biden's speech and the tremendous empathy and concern that he showed for the country. One person said it was like we were listening to Grandpa Biden, who cared so much for us. My mother-in-law lives with us. She's a Greek refugee. I lost my father-in-law about 2 years ago, and after that speech, she, with tears in her eyes, said, "I love that President Biden, Greg." Because she hit him, or he hit her in the heart. And I think President Biden's exhortation for us we can get through this, but we have to get through it together, is what this is all about. And so his announcement last night that the vaccine, every adult will have access to the vaccine by May the 1st, is an incredible milestone, because May 1st is not far away. So we're going to have a lot of supply of vaccines starting here in the city in the next 2 to 3 weeks or so. and then painting the picture that come July 4th, the traditional holiday celebration for us in our country, the ability to get back together with our families again. So things we just used to take for granted have been out of reach, and so there is so much reason for hope. But we got to get the job done ourselves, as he said as well. It's not a guarantee. For now, we've got to maintain vigilance about wearing masks and keeping social distance. There's a lot of work to be done by a lot of people that has to happen over the next few months, but man, it feels good to finally see what looks like could be an end to this pandemic and this dastardly virus. So we're getting closer and closer every day to being able to hug our loved ones, go to the restaurants we wanted to, and laugh and go to ball games and concerts. And so that day is coming thanks to the hard work of a lot of great people here, dedicated scientists, professionals, volunteers all over the country, including right here at LouVax. We're excited that starting on Monday, our LouVax team and our vaccination partners around the city will be scheduling more people for appointments. We're following the governor and Dr. Stack's announcement about the expansion of Tier 1C eligibility, which includes people with medical conditions that put them at higher risk, as well as more of our essential workers. Dr. Hartlage will have more information and details on that in a moment. We're still going to emphasize vaccinating people over 60, as we have been, but we're excited that supplies are increasing and opportunities are increasing to open up the vaccine to more people so we can save lives and eliminate COVID-19. But this really is an incredible week for our country. In addition to that announcement, yesterday's signing of the American Rescue Plan makes a huge step for our city and a tremendous progress step for our ability to come back from this virus, both from a health standpoint and from an economic standpoint. The funding from the American Rescue Plan for city government alone is going to be around $430 million to be spent between now and the end of '23. And then there's other fund streams coming into the city like JCPS, not to mention the individual payments of $1,400, the tax credit for children. It's a big, big thing that we haven't seen in our country in a long time, if ever. So it's going to have tremendous impact on us here in Louisville overall, and particularly with our fight against COVID-19. We're going to be able to get more shots in arms, and of course, that's more about putting just shots in any arm. We're going to continue to make sure that we have an equitable response to this vaccine, which we're doing a good job and making good progress on that. So today, as part of that work, we're focused on the importance of vaccinating the members of our international community. You'll recognize our stars from 4 weeks ago. And as I've said then, our city's foreign-born population is what's fueled Louisville's population growth over the years. I really appreciate our international community, and I want our residents in the world to know that Louisville is a welcoming, compassionate, and a proudly diverse city. And we've been working with specific community and media partners since the beginning of this pandemic, sharing messages about the virus and testing options in over 26 different languages. And today we're really proud to welcome back some of our community partners here at LouVax. They are here to help us demonstrate that these vaccines are safe and reliable, and the best way to keep our families safe, rebuild our economy, fully reopen our schools, and eliminate COVID-19. Let's hear it for these guys right here. All right. All right, so today they're getting the second dose of their life-saving vaccine. And obviously they're going to help us spread the word about vaccinations throughout their community. So let's meet these all-stars. First, Haleh Karimi. Haleh was born in Iran and has been in Louisville since 1996. She works at the University of Louisville College of Business teaching computer information systems, analytics, and operations. She's well known in the community as a great citizen, well respected and influential voice in all communities, but in her local Muslim community, and she's been volunteering her efforts for the COVID-19 Multicultural Community Campaign to ensure immigrant communities know about COVID-19 testing events and vaccination efforts. Haleh, see, I was taking your attention away from the fact that you just got shot. Well done. All right, thank you. Farhan Abdi. He's already put his shirt down after showing off his impressive biceps here. Farhan was born in Somalia and has been in Louisville since 2008. He's the executive director of the Somali community of Louisville, has a passion for building collaborative partnerships to strengthen the Somali community in our city as a whole. You may recognize this good-looking guy from the Stay Strong Louisville campaign. He's been an integral partner for the Office of Globalization's COVID-19 Multicultural Community Campaign. Farhan, thank you, buddy. Doing a great job. Doctora Patricia Bautista. She was born and raised in Mexico, where she studied medicine at the School of Medicine at the National Autonomous University of Mexico. She moved to Louisville 27 years ago and obtained a master's degree in public health from the University of Louisville. She now works as a community liaison and health promotion at La Casita Center. Doctora, muchísimo gracias. There you go. And Kevin Usinga. Kevin was born and raised in Rwanda and has been in Louisville since 2007. After being appointed as assistant pastor for Buchel United Methodist Church in 2017, he founded See Forward Ministries and serves as its executive director, leading community building efforts focused on the African immigrant community. He has most recently served as the lead organizer for ongoing COVID-19 testing efforts in the Buchel area and also has impressive biceps. Kevin, thank you, buddy. All right, let's hear it for all of our volunteers here. And we'll just ask for brief comments on how the vaccine is being received in your community and any advice that you want to give to people. All right? Farhan, let's start with you. How's it going in the Somali community? What's the feeling for the vaccine?
Oh, the feeling is great, and it's just amazing that they have hope that this is coming to our communities, and as a leader, I took it, and they all feel like this will help them go back to normal. waxaan kaloo u sheegi lahaa dadka Soomaalida meelkan wuxuuna weydiiyey communitygiina sidee ay ka dareemayaan vaccinekan waxa uu sheegay in aanaka u baahannahay dadka communitygeena ka mid ah oo aan diyaar u nahay inaan qaadano shotkan si mataqaanaa horumarka iyo caafimaadka aan uga shaqeyno.
Mahat Senate. Thank you. Okay, good. Patricia, okay, you're a lifetime medical professional. How are we doing at La Casita in our Latinx community?
We are doing fine. We keep on promoting, preventive measures for everybody while we get the vaccine. If I may, querida comunidad, estoy aquí representándolos e invitándolos a que vengan a ponerse la vacuna. La vacuna ya fue aprobada para mayores de 16 años hacia arriba, el riesgo es chiquito, la vacuna es gratuita, es segura. Es mejor que enfermarse, perder días de trabajo o enfermar a su familia. Por favor, vengan, unámonos, seamos empáticos y cooperemos por nuestra salud, por la de nuestras familias, pero sobre todo por la salud de nuestra comunidad. Gracias.
Okay, get the vaccine, stay healthy. Gracias. Ale, you've been in Louisville a long time. How's our international community doing with the vaccine?
They're anxious. They're anxious to get the vaccine and get back to some sort of normalcy. You said that this pandemic really changed our lives. It also changed our minds as well. This whole year of isolation has led to, many studies has indicated that it has led to increase in depression, suicide, many other health issues. So in order to get back to some sort of a normalcy, this is the time for each and every one of us to really take the responsibility and do what we can to make our society a bit safer and healthier. And what you can do from one little step is to get the vaccine. And I know the Persian community are working hard to do that. You want me to say something Farsi? دوستان عزیز من اگه موقعی نوبت شما شد که اسمتون رو بنویسین و برین و واکسنتون رو بگیرین از این موقعیت حتما استفاده بکنین برای اینکه ما این احتیاج داریم که مملکتمون برگرده به حالت طبیعی و نرمال. Merci.
Thank you. Okay, Kevin, you're doing a lot of work with our African community. You're from Rwanda. You're a preacher. You got a lot to say. How are we doing with the vaccine?
Thanks, Mayor. We are doing well. We're still fighting some misinformation and rumors and disinformation out there, which was causing hesitancy with this vaccine. But we're starting to see some progress in our community. They are starting to believe. I think having been vaccinated myself, and with this opportunity of getting the second shot, we're starting to see some people making progress in accepting this vaccination and realizing that this is the greatest miracle that's ever happened, and they want to take advantage of this. There's progress there. Now I'll speak to this into Kinyarwanda and briefly into Swahili. Swali ya meya ilikuwa ni tunaona watu wa community yetu ya Waafrikani wako wanaona au wanasikia hii chanjo bila gani, na jibu yangu nimemwambia kwamba ndio watu wangali wana mawazo na swali kuhusu hii chanjo, lakini cha muhimu tu tumeshaanza kuona watu wamoja tayari wameshapewa chanjo na wengine wanasubiria tu, lakini kwa ufupi nataka niwaambie hii ndo yenye itachukua ili tuendelee turudi kwa maisha yetu ya kawaida. Na wamisi wale wenye tunaabudu pamoja, tunaenda kanisani pamoja, msiwe na tatizo, njoni mpewe hii chanjo ili turudi kwa maisha yetu ya kawaida. Hakuna tatizo yoyote. Hanyuma ikibazo bambajije meya yambajije mu Kinyarwanda, nyisubiyemo mu Kinyarwanda kubumva ururimi rw'Ikinyarwanda. Yabaje ngo muri community yacu turimo abantu bari gufata gute runo rukingo. So igisubizo namuhaye nibyo turabizi ko abantu baracyafite impungenge kuri runo rukingo, barakibaza ibibazo byinshi kubera amakuru agenda atangazwa muri social media, kuri YouTube n'ahandi, ariko nashaka kubakangurira twege dufite amahirwe, muze dufate runo rukingo. Turabizi abantu b'iwacu muri Afrika ntabwo babonye amahirwe, so mukora ibishoboka byose muze dufate runo rukingo, dusubire mu buzima bwacu busanzwe, dusurane. Hari ababyeyi babyaye abana tutarasura, hari abafite ibibazo bitandukanye tutageraho. Mureke dukora ikintu twakagombye kuba dukora, ubuzima bwacu bukomeze. So murakoze. Thank you, Mayor.
Thank you, Kevin. Okay, folks, so we're saying we're making a lot of progress in all different areas of the community right now. Equity is a huge component of what we're doing. We're proud of what we have done, but we're always going to have a lot more to do. Now we're going to be getting the latest updates from Dr. SarahBeth Hartlage, our Associate Medical Director, and she's been running the LUVAX program here. So, Doc, take it away.
All right, so I'm going to begin with our regular data update. Vaccine doses administered. So here at LUVAX, we've now given a total of 59,162 doses, which is 37,836 primaries, 21,326 boosters. Across the metro area, including all providers, we've now administered 276,082 doses, which means that at least 36% of our local population has received at least one of the shots. Of those, we have about 178,000 primaries, and we have 98,012 people who have gotten their booster, so 13% of our population has completed the entire vaccine series. Here at LUVAX, our volunteer update, we now have a total number of registered volunteers, 6,616, who have given a total of 48,900 hours on this site. We have an estimated economic impact of about $1.3 million based on the labor that these people have donated. As the mayor said, this is something that we're doing together as a community, so we're grateful for all of our volunteers. 698 of them have now achieved their 40-hour milestone and been vaccinated, with more gaining that threshold every day. We do want to emphasize that we have some shifts available, so if you're looking to volunteer, that there's opportunity for you to come out here and help. Our volunteers work 4-hour shifts, so it's not necessarily your whole day, and they also do not have to be clinical folks. So we have roles for nurses and other clinical personnel, but many roles for people without clinical experience as well. Some of those folks I have standing behind me. So as always, choosing our volunteers of the week is a challenge, but here's the group for this week. I have Mimi Welter, who works in the medical field herself, and she came through LouVax early on to get her vaccination. She said that she was impressed with how smoothly things ran here, and so she decided to come back and join us here on her days off to volunteer. So Mimi. And next I have Dawn Balcom, who is one of my Blue Vest team folks who are our clinical leaders. And Dawn is always willing to step up into any role. Yesterday she was in the pharmacy. Sometimes she's out there giving injections, other times serving in support roles. So Dawn's one of those people who can just kind of do everything, which we appreciate here, and appreciate her flexibility as well. As you know, we transitioned this week to the Pfizer vaccine, and anytime we implement new protocols, we know there's going to be some bumps. So we reached out to a couple of our volunteers who have been superstars for us in the past to help us specifically with that transition. So I have a couple of them as well. The first is Jessica Wood, who is a runner for our pharmacy station, helps keep us organized and keep the doses flowing out to the floor. So that when you come through, there's a shot to give you. And then last but certainly not least, I have Mike Clancy, who is a traffic flagger. We're separating our doses by lane. So if you're coming through for your first dose, you go in a different lane than if you would if you were coming through for your booster. And we knew that Mike's voluminous, shall we say, directions and enthusiastic waving of his traffic baton would get people to the right place. So on our first day, we had about 1,500 cars through here, and only 2 of them snuck into the wrong lane. So that's due to Mike's very enthusiastic efforts in traffic flagging. And then I also have my employee of the week, who is somebody that I can ask for some ridiculous things sometimes, and he always manages to deliver. This week I specifically asked him to find me something that looked like a waffle fry that would hold the tiny vials for the Pfizer vaccine, and within 24 hours he managed to deliver that product for us. So thanks to Matt Vanderpool for jumping in everywhere and being able to come up with creative solutions to all of our unique problems here. All right, so looking forward, there was an announcement yesterday from the governor, so we're going to offer a little bit of clarity on eligibility and what's coming next. So right now, we are continuing to give primary doses to adults over the age of 60. As of today, everyone currently on the Norton waitlist has been offered an appointment either here at Norton, or either here at LouVax or at a Norton facility. Keep in mind that many of these appointments are scheduled a couple weeks from now, so they are on the schedule but maybe have not had their vaccination yet. Even so, we're hopeful that we can finish the lion's share of that 60-plus group by the end of March. So yesterday, Governor Fischer and Dr. Stack announced that sites should begin expanding to all of the Phase 1 population, but should still continue to emphasize adults over the age of 60. This is consistent with guidance from our Metro Vaccine Distribution Task Force, which discussed the same issues in our meeting this week. And it's also consistent with how all of our local providers are currently operating. So we're currently continuing with adults over 60 and expect to have them all scheduled soon. In the coming days and weeks, we will be opening scheduling availability to the remainder of Phase 1C, and expect to see these people vaccinated beginning around the beginning of April. As a reminder, Phase 1C does include a very broad segment of the population. We've been talking about those adults over the age of 60, but it also includes people over 16 who have a qualifying medical condition. Those include, but are certainly not limited to, high blood pressure and heart disease, lung diseases like COPD, diabetes, obesity, and pregnancy. If you're in that group, you will not be required to submit any documentation from your physician or healthcare provider to prove your eligibility. You may be required to complete a self-attestation, which is to say it may ask you to click a button saying, yes, I qualify, but there is no need for you to call your doctor and ask for documentation at this time. The other component in Phase 1C is essential employees, and we're very grateful to these people for keeping our community running over the past year. If you're an essential employee, you will soon be able to schedule an appointment, and you will not be required to submit documentation from your employer. If you are an essential employer and would like to help your employees organize and receive vaccinations as a group, we have a team dedicated to working with groups like you. There is now a form on our website that your HR or senior manager can fill out and as a primary contact, and then someone from that team will reach out to you to continue the process from there. Again, this form should be limited to human resources leaders from a given employer and should not be filled out by individuals. It does not register you for a vaccine, and individuals will be able to register separately as well. This form is only to help organize larger groups of employees if a given employer desires to do that. A member of our team will reach out to you after we receive that form to collect information and begin the process of getting your employees scheduled for a vaccination. Remember, you can always visit our website at louisvilleky.gov/vaccine or call the helpline for the most up-to-date information about vaccine eligibility and links to all the places you can directly register for an appointment. Here at LouVax, we did transition to the Pfizer vaccine product this week, so all primary shots at this location are Pfizer from here on out. And if you got a Moderna primary, there's no need to be concerned. Your Moderna booster is still here for you. You still get it at this same site in just the same way. The Janssen supply remains very limited and at present is being used for targeted missions like homeless shelters, which that work is ongoing starting this week. We expect to receive additional supply, but not for a couple more weeks. And so we're ramping up our community mobile mission planning to give those vaccines when they do arrive. Finally, remember that 231 million people worldwide have received a COVID vaccine, and there have been 0 deaths in that group. To put it simply, all 3 vaccines are 100% effective at preventing death from COVID. And so I encourage you not to shop around. Get vaccinated when your turn comes up with whatever product is available. Each dose saves lives and not just yours. That's all I have. We'll go ahead and take questions. So the question is about when is this site going to be similar to accepting public registrations the way some of the other sites do. That is probably coming, but at the moment we're working through some very targeted groups and expect to continue doing that for a few more weeks. And then if and when we launch a public portal, we'll make that announcement. So there's no one waiting 3 hours today or yesterday. On Wednesday, there was a delay. It was related to the transition of the vaccine products from the Moderna to Pfizer. Our average time on a normal day, transit from gate to gate, is about 40 to 45 minutes, and that includes the 15-minute observation time at the end. So we're grateful to those people who were able to wait, and we're sorry that they had to wait, but I'm glad they were able to get their vaccine. Most of the time, our waits are much, much shorter than that. Yeah, so the question is whether we're worried about people subverting the system to say that they have a medical condition or otherwise qualify when really they don't. We have seen throughout this process a very small number of people attempt to subvert the system all along the way. Same thing with healthcare workers. We saw some people making statements that they were healthcare workers when really they weren't. But at the same time, we're very respectful of the work that our healthcare workforce is doing. And so what we don't want to do is have all those people stop taking care of patients to write notes for everybody to get vaccines. So there's a very large number of conditions that qualify people under the chronic conditions, and it honestly will encompass a large number of people, but we're asking people to do the right thing. And if you qualify, please sign up when you're eligible. And if you don't, please wait your turn so that the people who need it most can have that access.
Let's just see if are there any other vaccine-related questions before we go to anything else? Okay. Sure. Yeah, we're in a much different place with the virus than where we were at the peak of the racial unrest, obviously with vaccines. Also, the events are outside, so that always gave us a level of protection as well. That being said, we're encouraging people to wear masks. We're encouraging people to social distance. You know, that works sometimes and it doesn't work other times. So we did not see an escalation in infections last year because of the protests that were held outside, so we certainly don't anticipate that as well. But we want people to follow their basic public health guidelines. As it relates to creating a safe environment, what we're doing is we've created a pedestrian plaza around Jefferson Square Park so people can come in without fear of any type of interference with automobiles or people that might be wanting to use automobiles for purposes not conducive to a safe gathering. So those barriers are going in place this morning, and they'll be in place until Sunday or so. We've worked with various protest groups to kind of get their feedback on our approach toward making sure this is a safe event, as well as public safety officials both here locally and in the region as well. So my hope is that we have a wonderful expression of the First Amendment, a solemn remembrance of the tragedy of Breonna Taylor, a demonstration of what civil rights looks like here in the community, so that we can show the rest of the country what a city looks like that's continuing to heal from this tragedy, and a city that's very serious about advancing racial equity. We have grave concerns about that relative to the First Amendment. Look, protest creates uncomfortable situations for a lot of people involved. But when we want to chill free speech in our country because it is inconvenient or uncomfortable, that's not aligned with the Constitution of the United States. So we need to balance what those competing interests are and realize that part of making a successful country is this kind of give and take that takes place. And sometimes it is awkward and sometimes it's really tough. But I definitely worry when it goes too far to chill free speech. Yeah, the question is thoughts on the 2 officer-involved shootings this week. First off, I'm sorry that they've taken place. Obviously, the community wanted to see more independence with officer-involved shootings, and that's why we asked Kentucky State Police to get involved. What their protocol allows is an initial statement by the local agency, and that's what you've seen from us come out with an initial statement, and then after that it goes to KSP in terms of further statements. And I recognize that's not what our community is used to. So we're also working through that process in terms of can there be additional input along the way, but right now those additional comments come from KSP so that we could pursue that further goal of what the community wanted, which was more independence. So I realize not everybody's happy about where this is right now. The question is, do we have any idea how many people are going to be attending the protest? Not really. We have to prepare for a lot of people, and there can be a lot of people as long as it's safe. I mean, our goal is to have just a safe weekend here, and that's very possible if everybody does what they're supposed to do. So we're prepared for the full square and area to be involved for marches, whatever we want to do, or whatever needs to be done. We're going to accommodate First Amendment rights. We do not want to see any destruction of property, any hurt or injury to any people. So we want to work with everybody to make sure those outcomes are achieved. Okay, thanks everybody for coming out today. Thank you all for getting your shot on. All right.